Hello, everyone. This is Kayla Steffen with NHA. Thanks so much for taking time to join us today. We will give everyone just a couple of minutes. I know we are right at the top of the hour, but had a couple of fun Zoom connection issues today. So we'll get everyone a few minutes to get joined in here, and then we'll get started. Thank you all. All right, again, this is Kayla Steffen with NHA. We'll get started in about 1 minute. Thank you all for joining today. All right, we are officially 2 minutes past the hour, and we want to be mindful and respectful of your time today. So we will go ahead and kick things off. Thank everyone for joining today. We really appreciate your time. My name is Kayla Steffen, and I'm the business development manager here at the National Health Career Association. And I'm going to serve as your host through the first half of today's presentation on the communication skills builder. We really appreciate you taking time out of your schedules to join us today. Before we get started, just wanted to align on a couple of really general housekeeping rules and expectations for our time together. First and foremost, this webinar is being recorded. So in follow-up to our session today, you will receive the recording as well as some general information about the skills builder that we talk through with you today. We do welcome questions during our session today, and we encourage questions. So please type those into the chat function. We will have NHA team members monitoring the chat. We'll do our best to address your questions either in the chat or live. But if we don't get to your question, please know that we will be capturing the chat and we'll send a personal follow-up to you after our session today. If you do have questions that are specific to your NHA account, please reach out to your NHA specialist directly. If you don't have an NHA specialist, we will be sending, again, that follow-up information that will contain some contact information for you. So we will provide that to you. So we're here to do our best and to answer any of your questions and to provide some timely replies. So the first half of today's presentation will be a demo. I will take you through NHA Skills Builder resources in detail. Now, if you've already seen a demo of these products, don't go away, stay tuned. So you might have seen that from me or maybe from another NHA team member. I will be showing some features and some functions today that you most likely haven't seen. So we have released something really new and exciting. So make sure you stay tuned for that. But most importantly, stay tuned because in the second half of our time together today, Dr. Mary Brinker will provide you with an educator's perspective, and she'll walk you through the process that she went through to implement NHA Skills Builder. So she'll talk about why she chose to implement, what courses she's implementing in, some specific implementation strategies, some student outcomes from implementation. So again, thank you so much for your time today. I'm really looking forward to hearing from Dr. Brinker, and I'll do my best to engage you until her time. So let's dive right in here. So first, for just a little bit of background. Now, many of you know NHA as a certification agency. That's who we've been, that's who we are for over 30 years now. But NHA is constantly plugged into the needs of the industry. We work closely with both educators and employers across the nation. And we often hear about skills gaps or teaching pain points. So we really listen to these things and evaluate to help bridge some of the gaps. And that's why we've evolved from being just a certification provider to producing learning resources like our Pharmaceer complete didactic pharmacy technician training, or medical terminology and anatomy and physiology, which are our foundational learning resources, as well as the personability soft skills resource and the principles of health coaching resource that we'll talk about here today. So let's talk a little bit about the communication skills builder. That's what we're here to learn about today. So I'm going to share my screen with you. And let's get right into it. So we're going to talk about the components that make up the communication skills builder. And Mary, I can see you on my screen. Can you shake my head if you can see my screen where that says personability and principles of health coaching?
Yes.
All right, perfect. So we're off to a good technology start. That's exciting. You got to love that when we have several people on the webinar here. So personability and principles of health coaching combine to make what we call the communication skills builder package that we'll be talking about today. So personability is seen as the foundational component that builds those soft essential skills, basic professionalism skills. That's kind of the first foundational component. And then we come in and we build and expand on those things with principles of health coaching, especially around the communication component when we talk about things like patient engagement, patient adherence, etc. These products can live separately or they can live together in what we call this communication skills builder. So let's break these things down and break them apart a little bit. And let's start with the foundational component, which is personability. This all came about because we, in our conversations with healthcare employers and educators, constantly heard of a gap in the soft skills. 93% of employers in the nation came back and told us that they didn't feel like their healthcare professionals had adequate training in soft skills. And so NHA took what we're really good at and what we're known for historically, which is assessment, and we combined that with virtual simulation to create personability. What's really unique about this is that it is soft skills training specifically for healthcare professionals. That's another thing that makes it really unique. And we've structured the training in a way that's geared towards driving behavior change. I think we've all completed those run-of-the-mill kind of click-through trainings. This is not that. So we're engaging via virtual simulation, assessment. We're structuring the training in a way that's geared towards driving behavior change for healthcare professionals. Now, it's really important to talk about what are we talking about when we talk about soft skills, just to make sure that we're on the same page. These are the skills that are covered in personability. So again, the foundational components like professionalism, building a personal brand, everything from character to appearance to online reputation. We talk a lot about critical thinking and we introduce a 3-step method for problem solving. That's something that we hear of as a skill that's often lacking from the employers that we engage with across the nation. We talk about being self-aware and understanding yourself as well as the ability to understand others. So expressing empathy and knowing why that's so important as a healthcare professional. Talk about all of the different types of communication, things like knowing your audience and active listening. And we get into teamwork skills. As a healthcare professional, can we depend on you to manage your time, to follow through and to be consistent with your quality? Adaptability is certainly a big one as well. As the healthcare landscape is constantly changing, how well are you able to adapt and accept and learn in and through change? And then finally, this concept of collaboration, working in a collaborative environment, supporting each other. Not only are you working with patients and their families, but we're working with coworkers and providers. And so we really want to dive into this relationship building process. So you can see personability is really just about developing this professional mindset that's both success focused and service focused. Now, I mentioned it is all about driving behavior change. So personability is very uniquely structured in a way that is using what we call gating technology, meaning that learners have to progress through in the order that you see here on your screen. So we start them off with a baseline assessment, which is a simulation. So we instantly engage them and immerse them in a scenario, which is such a unique way to learn. So we bring them in right from the very beginning. We'll take a look at that simulation here in just a couple of minutes. Then they'll progress through to the didactic learning modules covering those topics that we just looked at. We want to make sure they're not just clicking through those things. So they'll see a midpoint assessment of which they do have to achieve a benchmark score. After they've achieved that benchmark score, they'll advance to 2 practice simulations. They have unlimited access to those. They can keep coming back and saying, hey, I wonder if I would have said this or done this differently, how would things have played out? And then finally, they'll see the final assessment, which is also a simulation. They do have to achieve a benchmark score there before they can unlock their proof of completion. That's a certificate of completion, and it is good for CE credit, which we'll talk about. And we do have another special thing that we've added on to personability called our career success kit that I'm very excited excited to share with you today that I'm guessing not many of you have seen. So Mary, you're my check because you're the only one I can see. So can you see on my screen where it says personability in the gates here? Is that a yes? Yes. Okay.
Yes.
All right. Hey, we're rocking and rolling. So this is personability. You can see the branching or the gating technology here. So we start with that baseline assessment. I'm actually going to make sure that you can hear my computer sound. There we go. So let's take a look at this baseline assessment. Again, this is the first thing learners see when they come into personability is this simulation. It's all about de-escalating a patient challenge. So this is a recording of the simulation that I'll play out for you, but our learners will be engaged live, making decisions as they go. I do want to just point out that no clinical skills are necessary or required to complete personability. We're solely focused on those soft essential skills. So this can really work for anyone that's a healthcare professional, regardless of if you're clinical or administrative. So I'm going to click play and we'll talk about this as we go.
How you doing today, Mr. Ferguson?
Better now that I'm back here, but man, I didn't think you were ever going to call my name.
I'm sorry. We had an office emergency earlier and now we're running a little behind, but thanks for waiting. So you're here for an injection for a pollen allergy, is that right?
Same time every month, and I never had to wait like that before.
All right, so now we're given the opportunity to engage with the simulation. So you can see the talk button appears here for our learners. And when they click that, they're given several options. They can choose to give information and just tell them, hey, we get really swamped in the afternoons, or they can agree and say, you know what, I get it. Waiting to be seen can be really frustrating, or everyone gets frustrated when they have to wait. Now, based off of what our learner chooses, the simulation is going to play out accordingly. We call that branching technology. You might have heard of that as like a choose your own adventure, but either way, our learners are experiencing a consequence for their actions here in a safe environment. All the while, we're tracking those decisions and the responses on the back end. And I'll show you what that reporting looks like here in just a moment. But for now, let's see how this scenario plays out.
I know. Everyone gets frustrated when they have to wait.
I'd bet what I'm feeling is just a little bit more than everyone else.
So, the nurse will be in to give you your injection in just a few minutes.
Now I gotta wait for the nurse? How long's that gonna take?
She'll be in as soon as she can. Then, after your injection, I'll be back to give you your paperwork and escort you to the waiting area so you can wait the required 20 minutes.
Yeah, fine. Just keep things moving.
I'm going to let it stop right here. This continues to play. If you all noticed where Mr. Ferguson's eyes were here, they were looking at his phone. You could hear his phone going off. So he's clearly distracted as Henry is explaining what's going to happen next. Now, if you can anticipate, that's going to be a problem later, right? So he's going to say, hey, here's your paperwork. Let's go to the waiting room and wait those 20 minutes. And that's not going to go over well here with Mr. Ferguson. He's going to say, what? I didn't know I had to wait 20 minutes. And we're continuing to de-escalate from there. So we're constantly providing these ways in which the learners can engage. I don't know about you all, but last time I had to de-escalate just a challenge with anyone or a human being, I couldn't say just one nice thing and everything was rainbows and butterflies. And so we really want to simulate that actual scenario for the learners. So when they exit the video or once they finish the simulation, they'll see a performance dashboard that looks like this. It'll say, here's how you did overall, which is a composite of your technique scores. And we score on techniques like how well did you ask open-ended questions, and how well did you express empathy and use critical thinking, and how well did you use those 3 steps for problem solving called AIM, again, align, inquire, and make a plan. How well did you do that? What's really interesting in thinking back to this is, again, all about driving behavior change. We don't just say, you didn't do a great job of asking open-ended questions. We'll actually show the learner what they said. And that way they can say, oh, well, I'm not just like, oh, I didn't ask open-ended questions. Well, I thought I did. Here's what you said. And so I can think about how I can do that differently the next time. So then we progress right into, and you can see it just leads us right into the next step, which are the didactic modules. Just to take a peek at these, this is meaningful content in short stints, very similar to how other NHA kind of didactic learning is set up. We engage learners along the way with things like case studies and journaling prompts and some practice activity questions. We present professional points of view where they hear from other industry professionals about whatever the topics may be. So they're getting a wide variety of perspectives as they go. We also will plug in some additional resources. So here's some self-reflection activities to say, these are optional, so they don't have to do these, but hey, let's do some self-reflection on the various elements of good communication. Rank those by importance, rank your ability. Whatever you're ranking for your lower for your ability, maybe let's build a plan around that. Let's think about how we can improve that for you. Again, these are optional. This is a great way for either employers or educators to come back and say, I'm noticing some skills gaps with either this cohort or this group or this individual, and we really need to build a plan or maybe kind of scrub and polish those things a little bit more. This is something that's really important to us, and we want to make sure that we're really reinforcing it. So we look at a wide variety of topics here. Again, this is not required to complete personability, but it is something that's built in so that you're not having to build those things on your own. We also have a response sheet here for those case studies. So there's 19 case studies built into personability. This just says, let's take a look at that a little bit deeper. Let's dive in a little bit more, think about that thing a little bit differently. So NHA provides the prompt or the assignment here, and the candidates can plug in their answers. Again, you don't have to do these at all. You can pick and choose, hey, let's just do the one on texting or covering a shift or patient understanding. So you can pick and choose what you offer out of these as well. Finally, there is a response sheet here, or excuse me, a reference sheet here for those problem solving techniques and steps on that 3-step AIM methodology. So the align, inquire, and make a plan, just a reference sheet. So if I need a quick thought starter to say, I'm trying to ask an open-ended question. So instead of saying this, here's a phrase that I can use to get started, or just a little thought starter here for some ways to express empathy. This reference sheet can come in really handy for that. So those are the didactic modules. Then again, we advance to that midpoint assessment. We want to make sure the learners aren't just clicking through. The learners do have to achieve a benchmark score here. And once they've done that, they'll be able to unlock 2 practice simulations. One of those is all about problem solving with a coworker, and it plays out just like the baseline assessment that we just saw. And again, they have unlimited attempts at this practice simulation, so they can keep coming back and saying, hey, wonder if I would have said this or done this differently, how would this have played out? The other simulation is all about receiving professional feedback. So it's practice talking with a supervisor or a person in a position of power. That's something that I think either a lot of candidates don't have experience with, or no matter how long we've been in the field, it's something that we could all use a little practice with. Once the learner's ready, they can take the final assessment, which is takes place back in the back office environment again. And it really just brings together everything that the candidate has learned to this point. So practice asking open-ended questions, expressing empathy, good communication to help Mrs. Miller here navigate her visit. Again, no clinical skills are necessary. We're just bringing together everything that we've learned. A benchmark score is required here. So once that learner passes, they can earn their certificate of completion that looks like this. Now, this is where, and if you've tuned out because you've seen personability before, or if you've used it, pay close attention. This is really important. First, there are 2 versions of personability. One is what you just saw, kind of our original personability for healthcare professionals in general. We do have another specific version for pharmacy technicians. So the general version for healthcare professionals in general is good for 6 CE credits for anyone that holds an NHA certification. The pharmacy technician version is ACPE accredited, and it is good for 9 CE credits for anyone that holds a certification in general, regardless of if it's NHA's or another certification. Now, something new that we have added is our career success kit. So this is something that you'll definitely want to see. So anyone that has access to personability will now get access to the career kit. And this is anyone that, so if you already have access to personability, once you purchase again for your new cohort or your next cohort, you will get this career success kit with personability. There is no additional cost to this. It did not raise the cost of personability, but this is a way of how do we help these learners tell their story? They've been through personability, which is really valuable. And now how do we help them articulate this both on paper and in their job interviews? And so we've created this kit. So we have things like resume samples and resume templates, cover letter samples and templates, interview tips and job search tips. We have thank you letter samples and templates. And these are really awesome resources here. So you can see this is the template and here's a sample. So if you're anything like me, I can look at this sample and I can want to duplicate this. But that's going to be a challenge for somebody like me who just doesn't do design well, or like, hey, I want that circle. How do I get it? Well, we've already put it there for you. So all you have to do is plug in your initials. So that's the advantage of some of those templates. So it really helps the learners to bring everything together that they've learned. We have things like a career success worksheet, and then we have a version specifically for those pharmacy technician students. And we have a link to the NHA job board as well. So we're connecting them specifically to jobs that have come to NHA or have been posted on our NHA job board that mention our credentials. So huge advantage to students, again, no cost to them, and any candidate that has access to personability will have access to the career success kit. Personability, final thing that I'll mention about that is we do have a toolkit as well for facilitators. So you've noticed that personability can be implemented in a wide variety of ways, whether it's something that the student does on their own, or maybe it is facilitated. If it is something you facilitate, we have things like PowerPoint slides, implementation guides, pacing guides for the facilitator and for the learner. So it's a really streamlined process, and we do everything we can to take care of some of that heavy lift for the instructor and the facilitator. We also are happy to help you with trying to figure out where in your program to have personability live. There's robust reporting included as well. So at the click of a button, you can see track learner engagement and learner performance, and ultimately that behavior change. So that is personability, and kind of, again, that foundational block of this communication skills builder package. Again, personability can live on its own or part of this package. The next component is principles of health coaching. Principles of health coaching really builds and expands specifically around that communication component when we talk about things like patient engagement and adherence and patient education. And really how this came about is that's Dr. Brinker's slides. We're not ready for those yet, but here we go. Really how this came about is because we tend to have an adherence issue in our nation. So we have half of patients leaving visits not understanding the information that they received. Less than 10% are adhering to their prescribed lifestyle changes, and only half are adhering to their prescribed medication. So a solution to this growing challenge in healthcare is this concept of health coaching. But what this is not is, it's not about making someone a health coach. It's about upskilling them or professionally developing them, or maybe career laddering them, or providing this additional skill set to those that have a high level of patient engagement so they can more actively engage patients in their care. So this is also, it can be self-paced or facilitated. The learning is designed to be completed in those short stints, and there is simulation built into principles of health coaching as well, where they can practice in that safe environment. This does align to accreditation standards, just like personability, and it does warrant a certificate of completion once the candidates have finished, as well as CE credits for both those that hold an NHA certification. And this is also a NCC accredited. So nurses can earn CNE credits for principles of health coaching. So just to look a little at the content included in principles of health coaching, the major difference here between principles of health coaching and personability is that principles of health coaching is modularized. So meaning that learners can complete in any order. So like most things with NHA, it doesn't matter if the learners complete modules 3 and then 1, then 2, then 4, that's okay. Unlike personability that's gated where they have to progress in a certain order. So those are the major difference structurally in the two resources. So to get into the content a little bit, again, we're really expanding on that patient engagement and communication component. So here we'll dive into things like, how do these health coaching techniques play a role in things like population health management and in managing and preventing chronic disease? And how do these techniques impact overall outcomes? Those are all huge things for employers today. So especially as your students are seeking a job, that's something really important to keep in mind if they understand how their engagements with a patient really impacts things like outcomes in managing and preventing chronic disease, et cetera. The next module talks about collaboration and communication. So we get into basic communication and engagement techniques. How do we deal with barriers in communication? We'll dive into some evidence communication approaches like the teach-back methodology for engaging patients. We'll dive a little bit deeper into considerations for phone communications, methods and best practices for electronic communications, which tends to be growing as well. Module 3, we'll get into our professional boundaries and responsibilities. And some of the things that we get into here are, what does that collaborative relationship with the healthcare provider look like? We talk about some things like in-home monitoring. We also get into topics like cultural differences and psychological and emotional health and social determinants of health. Maybe it's not about someone not wanting to adhere, but understanding some of the things that are going on that might be preventing this particular patient from adhering. I think those are really important as a healthcare professional to understand. Finally, module 4, we'll talk about some didactic foundational content on the principles and techniques for motivational interviewing. And we end with 3 virtual simulations where candidates can practice these motivational interviewing techniques through 3 different scenarios. So they will be able to interact and engage, and these play out just like the simulation that we saw in personability, where they can put these motivational interviewing skills into practice in this safe environment. Again, finally, it does award a certificate of completion upon once the candidate has finished. Again, this is ANCC accredited, so nurses and those that hold an NHA certification can earn 7 CE credits or CNEs for the completion of personability, or excuse me, principles of health coaching. So many P words. This does contain a facilitator toolkit as well, where we offer things like PowerPoint slides to help frame up modules, implementation guides to help with that process, things like lesson planning. We have it aligned to the various accreditation standards. So those are things that we provide to, again, help make that lift a little bit lighter for those that are implementing principles of health coaching and personability. I'm going to take a deep breath there. I'm sure you're ready to hear a different voice besides mine now. So I will provide an introduction to Dr. Mary Brinker. I'm really excited to introduce her to you today. Dr. Brinker is the Medical Assistant Program Director at Lehigh Carbon Community College. She entered the medical field in 1992, starting as a medical assistant. She worked in an MA role for 8 years prior to becoming a registered nurse. Her 15 years of teaching consists of BSN and ADN nursing and medical assistant programs. Dr. Brinker is also a simulation expert. She's designed, facilitated, and implemented clinical simulations for students in both clinical and medical assistant programs of study. Dr. Brinker has been creative in her implementation of NHA Skills Builder components, and I'm really excited to turn the time over to her today to share with you how she has gone about implementing the Communication Skills Builder into her program. And so I'm going to make sure I have everything pulled up here, Dr. Brinker, and I will turn it right on over to you.
Thank you, Kayla. I'm honored to be able to present what I have designed and implemented into the medical assistant program here at LTRI-C, utilizing the skills builder, and that's both personability and health coaching. So with that being said, let's move to the next slide. I give my information here. Should anybody want to reach out to me and have any questions, you can send me an email. That will be great. I will entertain any questions that way as well. Okay. what I started, how did I start? Where do you even begin to actually implement this program into a medical assistant program? I looked at our mission at Lehigh Carbon Community College, and I took notice to one of many mission statements, and one of them is serving the community. Serving the community is not only for our healthcare provider offices, it's also the students, and giving the students what they need to move forward in their aspirations of becoming a medical assistant. So I took that mission and I applied it to our very first advisory board meeting to get a feel from office managers, healthcare providers, to see what is it that we could improve upon. One of them was professionalism. The other topic that was huge in our discussion was critical thinkers. So both of those constructs or concepts were very important to our healthcare providers in the Lehigh Valley area. So when I looked at personability and health coaching, it's like, okay, this is a great program, but how do I already implement it into a one-year certified pack-filled program in order to get the best out of the both programs? So I looked at behaviors, interrelationships, and communication skills builders. I looked at all three of those. I also looked at the critical thinkers and what a lot of the healthcare providers and office managers have shared is that the MA is not only responsible for technical skills, they need their MAs to also be able to think. So I looked at the psychomotor skills as well as cognitive skills of instilling this program into my courses. Okay. So I had to figure out how to put these puzzle pieces together and allow the students to be able to take their professional learning from personability and health coaching as they did their modules and put it together in a huge puzzle piece. So I had to look at where can I implement this, and I already had concept maps developed for the MA students, and for them to be able to put all these pieces together in their thought process. Most nurses know concept maps as utilizing those to build the students' clinical reasoning skills, because what the nurse actually does is they take that clinical information, they analyze it, and they come up with a judgment. MAs don't come up with judgments, they don't analyze, but they sure do help collect that data for the healthcare providers, any licensure personnel to analyze that information. So that's how I separated my concepts in the development of my concept map. Okay, next one. So how and where? So I looked at the program as a whole. Our first medical assistant course is the MA Assistant 1. It's the first course that the students are put in the first semester. I knew that that was probably was not the course to implement the communication skills builder into the program, because at that point they're just learning what is an MA, what do MAs do. They're also learning the anatomy part of the A&P part of body structures, and they kind of like start interviewing patients in the lab. They start doing all that. So I looked at my learning outcomes. So for my second medical assistant course, which is number 2, my learning outcomes, I had 2 of them that actually fit well with the implementation of this communication skills packet. So the first one was, first they needed to correlate the pathophysiology of the diseases. So in my MA course number 2, they're learning a lot about common diseases that they may be exposed to when they get out there to do their capstone or work as an MA. So I took my 11 body systems and I came up with different diseases, most common, but they needed to correlate this pathophysiology to pharmacological therapeutic treatments, side effects, adverse and contraindications. They also needed to create a teaching brochure for both diagnostics and medical treatments and specific to those diseases. So my concept map was already developed in that manner where they had to describe the pathophysiology of the disease that they were assigned to. They then had to think further and think, well, what kind of diagnostics would my healthcare provider ask me to collect? This pretty much creates the MA to be a forward thinker and become prepared of what they anticipate what the healthcare provider would require for further treatment of that patient while the patient's in the office. So this was designed in a manner where they had to list some of the diagnostics, the medications that they thought would be for treatment for the disease that they were helping assist with this physical treatment for the patient. And also they were graded on creating teaching brochures that went along with that disease process. So one patient teaching brochure would be surrounded by a diagnostic that they had to prepare for that examination, and also a specific medications for treatments. Okay, you can go to the next. So this is an example of one of my students, two of my students. I put them in groups of two because our second course in the medical assistant program has a lot of work involved in it. So I allow my students to work in pairs. Besides, when they get out there to work, if they don't fully understand something, they can always reach out to other resources. So I think this builds teamwork among the two students and looking for information. So this is my template that my students receive for their concept map. And as you can see, I give them a fully written simulated case scenario that's assigned to them. And then they have to extract all that information from that case scenario. So they have to begin by giving me a summary of what's going on with their patient that they're taking care of through this simulated case scenario. The disease that that the patient's there for treatment, the pathophysiology, clinical symptoms that they'll hear their patients report to them. That's already integrated into the case scenario. And then what they need to do then is they need to think further and list some questions that they would actually ask that patient to get more information to put into the documentation so that the healthcare provider has that information. I take it another step further now down at the bottom here, where they have to list the diagnostic tests that are being done that they anticipate to be ready for, and then medications and treatments. So let's go to the next slide. So how I implemented personability and health coaching, the second part of this assignment, I created the health coaching page where the students had to give their perspectives of the disease. How is it going to impact that patient? This kind of like builds the empathy of the student so that they can understand where that patient is coming from. Prevention, how could prevention be? Because that could be a teaching or coaching moment that the MA may be asked to give brochures for. And then, of course, pharmacology, I wanted to get a little more substantial information on those medications that goes along with that disease process. So the pharmacological perspective part felt fit well in this section of the assignment. They also then would have to, for separate, they would have to add to this their diagnostic teaching brochure that I assigned them to go with the scenario, and the medication to develop that teaching brochure for that. For personability, I really like the AIM format to apply into my concept map. Now here, this is where the students would have to identify any challenges in the scenario. So when I've written these simulated case scenarios to give to them, I put in as real as I could of how a patient would act in that situation. So they had to report to me on this assignment, they had to identify the challenge that was threaded within the scenario. They had to inquire, they had to gain the other person's perspective and share their own perspective. Now they had to look at what would my patient's perspective possibly be and mine, and they had to see the difference between the two and the challenge with that. And then last but least, they had to make a plan of action. So, they had to identify these symptoms, how the patient was acting, and how they could help assist in this physical assessment with the physician with their input. So all in all, this kind of like puts it into a big teamwork perspective for this patient of how they can help and what can they do in helping this patient in this given situation. Okay. So I'm the type of educator that always wants to know what the students think about their assignments and, how can I improve the program for their learning purposes? I tell them that all the time. So L-Tri-C gives out students evaluations at the end of each semester. One of the questions on the L-Tri-C course evaluation was what instructional methods or material activities and so forth did it help them learn that course material. Besides everything that they mentioned here with PowerPoints, hands-on instructions, availability labs, and that were fun, and the PowerPoints, I had to highlight how this student had said about concept maps. So concept maps for her was a great learning tool for her to put things together. Okay. Of course, I wanted to know more deeply of what the students, so I developed a student evaluation for the concept map to see deeper information. Now, when you give a survey to a student, I pretty much had them drop it in a Dropbox, and it wasn't really confidential because they had to drop it under their name. So I only got 2 out of 8 students that participated in this. So I don't know if they felt weird putting a survey into a Dropbox for me, knowing it was from them. I can guarantee that this semester in my last lab with them, I will have them fill this out for me. And I will step out of the room and have them randomly put them in the envelope for me. So I'll probably have more responses, and and it will allow the students to confidently put their thoughts. But 2 out of 8 students completed the evaluation. 2 of them, these 2 students agreed 100% to all these topics that I had asked. The concept map assignment allowed them to, connect with a patient care for diagnostics that would be ordered. It helped them connect the patient's care for the medications that could be ordered. It helped them connect to the disease process that impacts a patient. It helped them connect the concepts of disease preventions. And it also helped their ability to identify and understand all aspects of patient care constructs during their internship. These 8 students right now are out on internship, and I have been actively doing site visits the last week, and I'm getting great reviews of how professional and how well prepared these students are. And I can't help but think that maybe that this activity has played a huge part into it. And that professional piece that personability and health coaching allows the students to engage in. Now, the modules and of personability and health coach are implemented into the course. It is on their weekly reading outline. So there's due dates for those where they have to drop in their percentages into the Dropbox, and they get graded. So they are graded items for the course. So it's not where they just randomly go into the program. And I strategically planned out those modules in their weekly reading prior to them even beginning the concept map assignment, so that they have that practice through the health coaching and personability before they even begin their concept map. So I just wanted to strengthen my concept map by implementing the personability and the health coaching into this, because professionalism and teaching and coaching patients is a huge part of an MA, along with that cognitive skill building of critically thinking through that concept map and connecting all those puzzle pieces together. Okay. Next slide. So here is qualitative information. I had open-ended questions, compare this learning outcome, correlate the pathophysiology of diseases. I wanted to make sure that I was connecting my student learning outcomes to this assignment as a whole. And this is what the students had both said: knowing what causes a disease and how it runs through the body system is a powerful tool for success. This helps us teach patients prevention before the disease takes over. And then last, patient teaching is the tool we need to help them prevent contraindications. They know when to call the office to ask for advice. Explain side effects so the patient doesn't get alarmed is a valuable tool. Educating them is our job, so they are aware. So these are great comments. I picked out the two best. I mean, there were more, but these really stood out for me when I reviewed the qualitative section of my surveys. So that's how I implemented personability and health coaching into my second course in the program. I hope you found this to be helpful and give you some great ideas of how you could implement it. And if you have any questions, you can simply just ask. Thank you.
Thank you so much, Dr. Brinker. We really appreciate it. The way you've implemented is so creative, and you've kind of gone above and beyond, and we really appreciate you sharing our insights today. There's several comments that I've seen come through here that have been very impressed with your work. So we really appreciate you sharing that with us today. We do have a little bit of extra time, so I do encourage you, if you have not yet, submit a question in the chat or in the Q&A. We'll take a couple of minutes to try to address some of those things before we sign off here today. A couple of things that I've noticed. As administrators, is there a way we can get access to the career kit as if we were students? It is something that you do have to invest in personability for your cohort of students. So it's not something that we can just send access to just because we can't necessarily control that. So once you have invested for your cohort or class of students, then yes, you automatically get the career kit access for that. In the CTE space, a question came up of, are students able to sit for the NHA exam their senior year, or your students are able to sit their senior year? Can they still earn the CE credits and apply them after they earn their certification? So that's a really great question, and I want to be really clear about this part. So the CE credit for personability and principles of health coaching cannot be applied retroactively, but your students can still engage with both resources. The recommendation is to engage with both, but hold off on the final assessment of personability and or principles of health coaching until they've taken and passed their certification exam, their national certification exam, whether it's medical assistant or whatever it is. Once they've taken and passed that exam, then they can take that final assessment for personability or principles of health coaching, and that will allow them to earn that CE credit. It's just an accreditation rule that we cannot apply that retroactively. So there is that little nuance that I do want to make sure that I'm clear on. Is there anything in either component on computer technology, like the baseline use of computers? That's something that comes up a lot. No. In short, no, but I mean, it does entail using computers. And so I think the simulation, the interaction, some of our practice activities and engagement, I think to help to get the user more comfortable with computers, we do have the certain sections that go into things like email communications and what those can look like and kind of how to frame those things up via email. But to say that it's the baseline use of computers, it's not necessarily something that we touch on. Trying to breeze through anything else that I'm seeing come through here. Again, if there's anything that we missed, we will certainly make sure that we address those. Average time it takes a student to complete personability. That is a really great question. And I'm going to give maybe the political answer of it depends, because it does. So it depends a lot on Dr. Brinker, as you have seen, has gone to some awesome links here to do just classroom engagement. So kind of depends on, are you going to facilitate it? If so, is it going to be all in the classroom, or are you going to, frame it up in the class, send them on their own to do an assignment, and then come back and discuss? So on average, and I'll just give you a baseline, I completed personability in about 6 hours. I went through it by myself. I didn't do anything additional. I only did what was required, and I did it in about 6 hours. So if you add the facilitation, it certainly can add some time to that. One thing that we'll share with you is an implementation guide. So in our follow-up email that you'll receive, it'll contain this recording, and we'll send some additional information about both personability and principles of health coaching. In that implementation guide, you will find a time breakdown by module, by simulation, et cetera. So we're happy to share that with you, and we will be sending that in follow-up. Trying to breeze through any other questions. Again, we want to be really mindful and respectful of your time. So we will wrap it up here. Again, I want to extend a special thanks to Dr. Brinker for all of her time today and her preparation and sharing this information with you. Thank you for sharing your email and your contact information. We'll include that as part of the follow-up as well. We do ask you that you're mindful and respectful of her time, but nonetheless, she's done a fantastic job of providing this information. So in follow-up, again, we will be providing you with this recording, some follow-up information that will come to you after the holiday. So you'll receive that sometime next week, but that will come your way. We'll also include NHA contact information. So if you have any questions, if you don't have an NHA representative, we'll include some general NHA contact info so you can get in touch with us, and we're more than happy to engage with you or answer any further questions or dive a little bit deeper. We're really grateful for your time. I hope you all have a safe and wonderful weekend. Any questions, send them our way. Have a great day, everyone. Thank you.
Thank you.
Thank you, Dr. Brinker.
Thank you.